Hello everyone, in this video we'll be studying about the osteology of tibia bone. So this is the medial bone of the leg. Now let's see about its feature. It has upper end, a shaft and a lower end. Lower end consists of a medial malleolus. Now let's see its anatomical position. So the broad upper end lies upwards. This is the shaft and this is the end portion which has medial malleolus. So it's the name suggests it lies medially, and this is the sharpest anterior border which is also known as shin. So head is facing upward, the sharpest anterior border and the medial malleolus. So this is the tibia bone of my left side. Now the upper end have two flat condyles for the articulation with condyles of femur. This is the medial condyle, this is the lateral condyle. You can see clearly medial condyle is somehow bigger than lateral condyle. Then between both the condyles lies the intercondylar area, or here is some eminence, that is intercondylar eminence, or you can see tubercles. Then on the anterior aspect of tibia lies tibial tuberosity, which gives attachment to ligamentum patelli. Now shaft. This is the anterior sharp border, which is also known as shin. This is the medial border and this is the lateral border. The surface between anterior border and medial border is medial surface. This is the medial surface. The surface between anterior and lateral border is lateral surface. And behind is the posterior surface. Let's see the attachments on upper end. Now, this is the medial condyle and this is the lateral condyle. It has four surfaces. Superior surface. This is the superior surface. Anterior surface. पीछे है posterior surface. The posterior surface, and this is the medial surface. Similarly, on the lateral condyle, superior surface, anterior surface, lateral surface, and the posterior surface. Now, on the anterior surface of lateral condyle, हमारा iliotibial tract का insertion होगा on Gerdy's tubercle. You can see here, I am marked here with blue color. Then on the posterior side of the medial condyle, we have a groove on which there is insertion of semimembranosus. You can see here semimembranosus का insertion होगा. Then lateral condyle के posterior surface पर एक facet है for fibula, that is known as fibular facet. Now this is tibial tuberosity, जहाँ मैंने आपको बताया था ligamentum patelli का attachment होगा. This is the medial surface, और medial surface के upper portion में हमारे तीन मसल्स का इंसर्शन होगा जो कि आपको याद रखना है. सबसे पहले sartorius, then gracilis, and then third one is semitendinous. So we can learn it by the mnemonic girl between two surgeon. Girl, G for girl, G for gracilis. Between two surgeon मतलब 2S. तो एक sartorius ऊपर वाला, that is inverted hockey shape, and below semitendinosus. Now on posterior surface we have soleal line, which gives origin to soleus muscle. Above the soleal line we have insertion of popliteus muscle. Below the soleus line we have some more muscle origin like tibialis posterior, flexure digitorum longus. Now we have nutrient foramen below the soleal line, and also the largest nutrient artery is in tibia, that is the branch of posterior tibial artery. Now this is the lower end. We have medial malleolus. It has five surfaces. The lower end have five surfaces: medial, lateral, anterior, posterior, and the inferior. Inferior surface articulates with the articular surface of talus, which is the bone of foot. Bone of yeah. Then this is the articular surface of tibia, inferior articular surface. Then medial malleolus. Medial malleolus के anterior side एक groove होता है for tibialis anterior, and posterior side का जो groove होता है that is for tibialis posterior. So So this is all about tibia bone. Thank you.